Hi, I'm Cheryl Connors. I'm a nurse who is pitching on behalf of our incredibly diverse multidisciplinary team from Johns Hopkins Hospital. Our project is called RISE. So the story goes, you're a member of the healthcare team, a code blue is called, your sympathetic nervous system rages as the child you've been caring for cannot be resuscitated. The team members feel like they failed. The mother falls apart. The father shouts angrily. The nurses are exhausted from multiple rounds of CPR. This type of experience is not uncommon. In fact, it occurs almost daily somewhere in the hospital. Staff customarily hang their heads, clean up, and move on. Healthcare workers are in dire need of support. The healthcare environment was already complicated and stressful before 2020, and the situation has been exacerbated by the ongoing COVID-19 pandemic. Staff have little to no physical space to retreat to after a situation like this. No place to process, no place to cry, no place to recharge before continuing to work. Restorative efforts are deserved and imperative, especially after being torched for the last few years. The data speaks for itself. Our healthcare workforce has access to RISE, a 24/7 volunteer peer support team that has existed since 2011. RISE is an effective resource seeking to expand care for our peers. Our RISE team is made up of compassionate volunteer responders who are trained to provide confidential support, yet we've had no dedicated or private space to do so. The solution we are proposing is to create a RISE Center. The RISE Center will provide space for rejuvenation, introspection, self-care, and empowerment. The center offers a menu of options for staff to choose from, promoting a sense of control and agency, including space for self-expression, immersive and sensory experiences designed to reduce stress, and confidential free support away from the work area in a central, accessible location. The space has already been dedicated to us for this purpose, demonstrating organizational commitment to staff support. The RISE Center will utilize a strategic approach for use and built-in evaluation measures. The RISE Center can accommodate up to 24 employees per hour, which would enable us to reach all of our employees often. Previous studies of related resources make us confident that the center will have a beneficial effect on stress, mood, and cognitive alertness for the people who use it. Each space in the center aims to meet a specific need. The corridor serves as a transition space from the clinical world to the center. The reception area is where staff will be greeted by a concierge. The consult room is a place to receive private, confidential peer support. The multi-purpose room is where staff can engage in art activities and programming independently or in groups. The multisensory room uses technology, body and motion to improve emotional regulation and processing of stressful and traumatic experiences. The tune bed is designed to vibrate, restoring balance to the mind and body, reducing stress and anxiety. The recharge room is a multisensory room that provides a touch-free, voice-activated immersion experience of choice, escape into nature, independently or communally, promoting a biophilic connection. These services all are evidence-based approaches to deactivate the nervous system quickly. A 10 to 15-minute exposure has proven effective at reducing stress and elevating mood. There are other programs offered at Johns Hopkins Hospital that are designed to support our healthcare workforce. While these resources are appreciated by staff, none of them offer the direct benefit of having a physical space to go for relaxation and rejuvenation at no cost 24/7. Over 12,000 employees serve Johns Hopkins Hospital. Thousands of them have sought support from the RISE team over the last 2.5 years. Our staff have validated high levels of burnout, stress, depletion, as well as a desire to feel more valued and appreciated and taken care of by Johns Hopkins. The RISE Center will not only offer a safe haven, a place of refuge, but it will be an oasis for restoration of the body and mind to our diverse healthcare workforce. The impact will be obvious, not just in their ability to perform at work, but in their personal lives as well. We are requesting $249,000 to be spent in 2023. The RISE Center will continue to be funded by Johns Hopkins Hospital, the Armstrong Institute for Patient Safety and Quality, as well as by individual and corporate donors. The Johns Hopkins leadership has dedicated the space and facility fees. The ideal design creates a financial deficit that we seek to cover. We are dedicated to making this resource not just good, but great. We are so grateful for any support that you might contribute to this crucial state-of-the-art program. Currently, staff are hiding in closets to escape. They seek respite in cluttered, undersized break rooms. Turnover is greater than ever and trending in the wrong direction. Johns Hopkins strives to be a place where people want to work. If we show our people that we are committed to them, they will be more committed to us. In addition, our center will be an attractive recruitment strategy. Every nurse that stays on the job saves the hospital $210,000 in replacement costs. The potential savings could be millions of dollars. Our proposed approach will have both an individual and organizational impact. The center will generate evidence to expand this concept across our system and ultimately across healthcare globally.
1 minute.
The most important sustainability factor, in addition to ongoing leadership support, is that the RISE team will lead this program. This team has been established over 11 years ago and continues to be run by the original founders. Collectively, Johns Hopkins is committed to putting action behind their words. And the new end to the story goes like this. 3 members of the patient's care team come to the center after experiencing a tragic death. They elect to participate in an immersive experience in the RISE Center's recharge room. They select to go to a beach with a bonfire. They sit back in the dimly lit room, surrounded by plants, a soft breeze, and the sound of a crackling fire and lapping of water. They stay for 15 minutes, sharing tears, letting go of the day's events. They grab a snack and water before leaving, feeling better, ready to take on the rest of the day, grateful to have been transported to a place of healing, if only for a short while. Thank you to my team, and thank you for sponsoring the Nurse Hack for Health Pitch-A-Thon.